Hi, and welcome to Something to Talk About. I'm Linda McNamee, and for the next hour, we will be talking about health. Yesterday, April 7th, was World Health Day, and we'll find out a little bit more about that later. And we will find out about health in Burlington. But before we get to that, as usual, I would like to invite you, if you have a question or a comment and would like to call in this evening, you are more than welcome to call 781-270-9199. I think that's the number, yes, because I didn't call because I'm here. Or if you think of a question later on or a comment or a suggestion for a future topic, you can always email me at talk@bcattv.org. And I would like to thank the staff here tonight. We have Kyle Ruffin and Corey McNeil, who help keep this place running and make sure everything gets to where it needs to be, and helps all the wonderful volunteers that volunteer their times. And speaking of volunteers, I would like to thank Colleen Moore, who is my director this evening, who is also a volunteer here and on the board of directors, and Tatiana Hawkins. Almost forgot Tatiana. And Tatiana is a student in Burlington, and she gives up her Wednesday evenings to help me out as well. So thank you guys very, very much. And I would last but definitely not least like to thank my husband Paul for staying home for daddy date night. Hopefully the kids are in bed before the show started. Now I would like to welcome my wonderful guest. We have Susan Luminello, who is the director of the Burlington Board of Health. Thank you very much for coming.
Thank you for inviting me.
And I can't wait for our discussion because there's a lot of questions. I started browsing around your website, became completely overwhelmed. So I figured, in a good way, it's like, wow, you guys do a lot and more. And then, then over here. So, okay, I would like to find out more about you and more about what the Burlington Board of Health does. So can you start out by kind of giving me a little bit of background, where you grew up, what you studied, where you went to school, and how you came to be the director?
Okay. So I'm from next door. I grew up in Woburn. I went to...
You say that right?
Yeah, Woburn. I went to Salem State, and I majored in geology with a concentration in environmental science.
Yeah. Okay.
After that, I started working in environmental consulting.
Okay.
I got married, moved to Burlington 21 years ago. So I've been in Burlington about 21 years.
Excellent.
I have 3 children, two currently in the Burlington schools. One graduated from Burlington High School. I became director, I became environmental engineer for the Board of Health.
Oh, okay. I read about that
in
title
2010.
Okay.
In 2012, I became the director. So
Excellent.
I started off as environmental engineer in that position.
Now, the director is a hired position, so it's not like a term of 5 years or anything. It's as long as you want to stay.
Yep.
Okay. Now, what's the difference between the paid staff and the elected board?
So we have a 5-member elected board, and they hire the paid staff. So for the paid staff, we have myself, the environmental engineer, a health agent, a public health nurse, and 2 clerks, a full-time and a part-time clerk.
Oh, okay. And how many members of the elected
5
board?
Elected members of the board.
And is that like a rotation of elections? Because we do have the election coming up, we mentioned.
Yes.
But it's not like all 5 of them are up for re-election at the same time.
We have, actually 2 were coming up for re-election. One retired, Jim Dion retired after 22 years of service on the board.
Excellent.
Yeah, and Libby Wallen-Jevitz is coming up for re-election.
Excellent. So what is your role as director, and how do you interact with the staff and the elected board?
So I see my role as director as trying to fulfill the mission of the Board of Health, which is to protect and promote the public health of the residents of Burlington. And in order to do that, there's I boil it down to 4 different ways. One being to enact and enforce regulations, both state mandated and local. Second being to do educational outreach in the community. Third being to to work on emergency preparedness activities, which is
Okay.
something that we need to do. It's a big
That seems
role.
to have like increased priority in the past few years as well.
Yes, I think kind of after 9/11,
Yeah.
that really, and a lot of things
Geez,
became,
which is 14 years ago now.
right. A lot of things became mandated by
Okay.
the Board of Health to do that. And then the last thing is to develop programs for the community.
What kind of programs?
So we
I
have.
know I'm going out of order, and I told you I wouldn't. Sorry.
Yeah, no, that's okay. We have our current programs, household hazardous waste collection.
Which
we
is
have-
also coming up.
Yep, we have April 25th.
Okay.
We have 2 of those per year, one in the spring and one in the fall,
Okay.
which are very popular. We also have flu clinics. We have one
Okay.
large-scale flu clinic, and then we also have kind of smaller-scale flu clinics.
Okay. The large scale one's actually held at the high school in October.
Well, it's been held at the high school. Last
Okay.
year, we held it at Memorial School.
Oh, okay.
So one of the things that we need to do for emergency preparedness
Mm-hmm.
is to have what's called an emergency dispensing site plan. And that would plan is if we ever had to vaccinate a large amount of people in the community, we need
Okay.
to be able to do that.
Kind of like what happened with measles out in Disneyland,
That
or something like that.
Yeah, I'm thinking of maybe even a larger scale. So if
okay.
yeah, so if we, I think kind of what it's based on is, say we had like had to give people antibiotics if there
Oh,
was
okay.
a anthrax, scare or attack or.
Okay.
So we need to be able to get a lot of people through quickly.
Okay.
So the flu clinic is a practice of that plan, or the
Oh, okay.
large scale flu clinic. That's what we use to kind of practice our
Okay.
plan. We held it last year at the Memorial School.
Do you know roughly how large scale it was? How many people normally come to that?
We did over 500 vaccinations
wow.
in 3 hours.
Oh, geez.
Yeah,
That's
yeah.
amazing.
Yeah, and so we also use our Burlington Volunteer Reserve Corps, our Medical Reserve
Okay.
Corps volunteers.
Yeah, I want to find
for
out more
that.
about that too.
Yeah.
That sounds pretty cool.
And last year we had 40 volunteers who helped us do that, both medical and non-medical. So all our dispensers were volunteers.
Excellent. Well, that helps out.
Yes, we wouldn't be able to do it without them.
Okay. Now you mentioned the volunteers. So can we like bounce over to the
Sure.
volunteer corps for a little bit? And what exactly are they? Are they like nursing students from Shawshing Tech or?
No,
Volunteers?
so
Yeah.
so after 9/11, there was a call out from President Bush for people to become more active and involved in their communities.
Okay.
And in 2002, the National Medical Reserve Corps was formed. So there's medical reserve corps all over the country. And these medical reserve corps have housing organizations. So the Burlington Volunteer Reserve Corps or Medical Reserve Corps,
Okay.
the housing organization for them is the Board of Health. So
Oh,
not
okay,
only
that kind of housing. I was thinking like,
No,
a
it's-
dorm or something.
No, we oversee them.
Okay.
Yeah. So I'm also the unit leader for the Medical Reserve Corps
Okay.
as Director of Public Health.
And is the corps like just in Burlington, or is it more of a regional thing like Burlington, Woburn, Winchester or something, or is it just?
So Medical Reserve Corps are made up of all different, they can be different. They can be large regions, they can be smaller regions.
Okay.
So the Burlington Medical Reserve Corps is just in Burlington.
Oh, okay.
There is a Region 4A Medical Reserve Corps. So Burlington is part of Emergency Preparedness Region 4A,
Oh, okay.
which is composed of 33 cities and towns in the area.
I won't make you name them.
So if we had to call upon volunteers from another Medical Reserve Corps,
okay.
we use a state program to do that. So
Okay.
we're in the national program, so we are in touch with the federal government. We also are in touch with the state government,
Okay.
and we do quarterly reports to the state on our activities, and we also do reports to the federal government on our activities. So anybody could go, if you Google Medical Reserve Corps, the National, they have a website. You can find all the Medical Reserve Corps in the area. You could go to Burlington and read our mission and see how many volunteers we have and what our activities are. So our volunteers are comprised of a wide range of people. We have students, we have working people, we have retired people.
Do they need a medical background to volunteer? Or?
No, no. Actually, we're looking for both medical and non-medical people because for every medical person that you have, you need 5 non-medical people to back them up.
Wow.
Yeah, because we need people to set up, people to, say in a flu clinic, you need people to organize the lines, get the flow going through, read forms, fill out forms, and so there's a lot of work.
Get the Band-Aids.
Yeah, there's a lot. Well, there's a lot of work that needs to be done to support those medical people that we have. So yeah, so currently we have 145 volunteers in Burlington. We're always looking to make that number more. And so we have an executive committee that consists of 5 volunteers who are working very hard to do outreach and to try and get more volunteers to join.
Excellent.
So, yeah.
So you did say that, founded in 2002, but it's pretty much up to the local organization how they want to structure it. But is there like federal regulations about you must do a minimum of this, this, and this?
No, it's pretty loose. So yeah, the Burlington Volunteer Reserve Corps was founded in 2008. Okay. So the requirements are that we report to them. So they want to know what you're doing. So we have to make sure that we have regular activities. So we have trainings, we have regular meetings. We have to make sure that our volunteers are properly trained. So
absolutely.
We had a CPR training today for our volunteers.
I'm doing CPR training on Saturday for the Girl Scouts.
Yeah.
Should have done yours.
You could become a volunteer.
Yeah, in my spare time. I'll keep that in mind.
We need to keep them active, and they help out with the idea is for them to help out with public health initiatives. So they do the household hazardous waste collection, the flu clinics. They'll do, sometimes we'll get requests for a community event, like something like a road race or something. Yeah, if they contacted us and said, we'd like to see if we can use your volunteers to come and, do whatever, maybe a medical tent or something, first aid tent. We could do something like that. We partner with the American Red Cross, so they go to the blood drives in Burlington and assist with those. They're pretty active, and we try to keep them active.
It sounds like you're doing a lot.
Yeah, we have quarterly meetings, and at each one of those meetings we try to have a speaker on a different subject.
Health-related subject?
Yeah, either health-related or emergency preparedness related. Yeah. And so the big thing about having the Medical Reserve Corps and having the volunteers ahead of time is to make sure that they've all, because after 9/11 they had a lot of volunteers that came forward and said, I want to help.
I want to help, but I don't know what to do.
They didn't know what their training was. They didn't know what their backgrounds were. So we keep all that information in the database on our volunteers. So we know what trainings they have, we know what licenses they have, and they've all gone through, been quarried.
I was just about to ask, do they have to be quarried?
Yeah. Yeah, so that's all done ahead of time. So we know, which volunteers would be good in which places.
So kind of match their experience with the right circumstances.
Yeah, so if you needed nurses, we could bring up a list of nurses pretty quickly and see, and then just do a call out to nurses.
Okay, excellent. So if somebody were interested in becoming a volunteer, they could look on your the Board of Health website and find out more information and contact information. And
they can always call the Board of Health office. And then also they could go to massresponse.org and sign up directly through the state website. So if you go onto that and it asks you which unit you'd like to join, so just make sure you choose Burlington Volunteer Reserve Corps. It'll ask you to set up a profile, so you set up a profile, and then you print out your Corey form, mail it in, and then we get your information right away. We would contact you, ask you to come into the office. As soon as your Corey goes through, we take a picture for your ID badge. And
you get an ID?
Yeah, we have ID badges for all our volunteers. Yep.
These are the little things, and
motivate me. Okay. Now, is there anything more you want to say about that?
No.
Okay. It seemed really complete. I just, wanted to kind of move on because,
Okay.
again, queen of tangents, here I go. In your introduction, you said before becoming the director, you were the environmental engineer.
Yes.
What exactly does that encompass?
So that is, the environmental engineer oversees certain programs. So she oversees the household hazardous waste collection. So that's
Okay.
planning for that twice a year. Oversees the mosquito control program, which is...
That's right, those really loud trucks. You
Yes.
want to close your windows before you hear them driving down the street. Close the windows.
Right.
Okay.
So
sorry.
we are part of the East Middlesex Mosquito Control Project,
Okay.
which is again, a number of cities and towns that contribute to the project. And they do helicopter larvicide spraying in the springtime over
Okay.
a portion of wetlands in Burlington.
Okay.
They do larvicide into the catch basins twice
Okay.
a year. They also set out traps in like 4 areas of town, and they count the mosquitoes in those traps. And if there's high mosquito population in one area of town,
Okay.
they will say, okay, this area we need to do truck-mounted spraying, and
Okay.
we will inform residents of when the spraying is going to be conducted and where.
Okay.
And residents have the option of opting out of that if they want. They can fill out a form at the town clerk's office, and when the truck goes by your street, when they go by your house, they'll shut the sprayer off, and then when they get past your house, they'll turn it back
Yeah,
on.
don't spray my house. I want to, risk getting malaria or,
Well, the
whatever.
yeah.
Why
the
would
threat-
somebody not want to do? Sorry.
We have a few people who decided
Okay.
to opt out. Yeah.
Okay.
So the threat of is really West Nile
Yeah.
virus.
I just couldn't think of West Nile.
In Massachusetts, it's West Nile and also Eastern equine encephalitis. Not so much in our part of the state, more in the southern part.
Cape?
Yes, it's my understanding you have to have old cedar growth forests in order to have the type of mosquitoes that carry
Okay.
Tripoli, which we don't have in Burlington.
Now,
so.
how long has Burlington been do you know offhand how long we've been doing the mosquito thing?
It's been many years.
Okay.
I'm not sure how long, but Terry McSweeney, who retired from the board last year after 37 years.
Oh, wow.
Yeah, I think he told me stories about when that came in. So that was early in
So
his
obviously it's being
career. So
you
it's
can
been
tell it's been effective because we've been doing it for years.
yeah, we've been doing it for many years.
Oh, okay.
And also too, it gives us when they count the mosquitoes, they also test the mosquitoes. So they can say, we found a mosquito that's carrying West Nile virus in Burlington, and then we warn residents and put ads in the
Okay.
paper and try to
So it's not that
educate.
somebody has gotten sick, it's through these tests.
It's that the mosquito has it, not that a
okay.
person has it.
Okay, because I've often wondered, like watching the news, it's like, Tripoli has been found in this town, and I'm like, somebody like in the hospital or something? So
Yeah.
it's a testing. Oh,
So
okay.
they would tell you it's been found in a mosquito, it's been found in it's
Okay.
like a mammal, like a horse,
Okay.
in the instance of Tripoli,
Raccoon
or a person.
A person.
Yeah.
Oh, okay.
Yeah. So, I mean, obviously, if it was in a person, that would be a little bit more of an alert than in a mosquito. But we still like to, inform people that they should, cover up, use mosquito repellent, and empty out all water in their
Yeah,
yards.
freestanding water.
Yeah.
My husband is a stickler for the wading pool that like the kids play in every night. It's got to be dumped and put away.
Yeah.
So, with Hazardous Waste Day coming up, you did mention that that is part of the role of the environmental engineer. How long has Burlington been doing that? Do you know offhand what is allowed, what is not allowed, and what happens if somebody misses that twice a year? Are they stuck keeping hazardous waste at their house until the next one, or?
Yeah, so mainly what we collect
Okay.
is things like paints, oils, so people who change their oil, people who have oil from a lawnmower.
Okay.
So those types of things, yeah, we have it twice per year.
Okay. The fluorescent light bulbs and
Fluorescent, yeah, we also collect
the batteries.
mercury products, and batteries, so fluorescent light bulbs, mercury thermometers, mercury thermostats, batteries, propane tanks. So we do take those.
Okay. What about like medical sharps? Do you do that anymore?
We used to do medical sharps at the household hazardous waste collection event, but we do not anymore. So in 2012, July 2012, it became illegal to put those in the trash. So what we did is we were looking at a better way to dispose of these than at a household hazardous waste collection event, because those are the types of the things that build up and that people don't want to keep in their house for twice a year.
Okay.
So we got a grant from Leahy to get a kiosk for medical sharps, which is located now in the lobby of the fire department. So residents can, we give out free sharps containers.
Okay.
So a resident can come to our office, get a free sharps container, and then dispose of that in the kiosk in the fire department 24/7. So it's available all the time. Yeah, and that's been a popular program, and it works out a lot better than having this collection at the household hazardous waste event.
Okay.
So
Now, as soon as you said fire department, I'm thinking my kids did a tour of the Wilmington Fire Department, and in their lobby, they have like a kiosk for prescription meds.
yep.
How does Burlington handle, or what is your advice for people that have like either old prescription meds or even like old bottles of aspirin that have, long since expired? What do we do with those?
So environmentalists don't want you to put them down the drain because they get into your
Water supply.
And police don't want you to put them in the trash because then someone could get into your trash and take them out.
So what do we do?
So in 2010, shortly after I became environmental engineer, it just so happened that Household Hazardous Waste Day fell on Prescription Drug Take-Back Day. So there is a Prescription Drug Take-Back Day once a year in September, and prescription drugs can only be taken back by the police. So we coordinated with the police to come to our household hazardous waste collection and have an area for prescription drug take-back that year. So it worked out really well, and the police collected a lot of prescription drugs. And shortly thereafter, they decided to get a kiosk. So now the police department has a kiosk in their lobby where residents can bring prescription drugs and put them in their kiosk. So we have the kiosk for the medical shops in the fire department and the kiosk for the prescription drugs in the police department.
And what about like over-the-counter meds? Are those okay to just like dispose of? Because I'm just thinking of my medicine cabinet at home. I have like, cold medicine that expired in like 2009.
Yeah, I mean,
I don't think I want to take that anymore.
that might be okay to put in the trash.
Okay.
Not dump it down the drain, but to put something in the trash, I think like that would be okay because
Wrap it
anybody
in
can
duct
go down
tape
to the drugstore and
first.
get it anyways, right? So yeah.
Okay.
Yeah.
That makes a lot of sense. So, in addition to Hazardous Waste Day and mosquitoes.
Yeah, we're still doing on the environment. I didn't finish the environmental engineer.
Okay.
So she's
No, because
got
there was another question
lot
here
more.
about lead paint and carbon monoxide and all that kind of stuff. So
So other things the environmental engineer does is review site plans for the planning department. So she
and
has.
why is that?
Well, she has to stay on top of all the disposal sites in town. So so that when redevelopment occurs, we are on top of that. So we know, a redevelopment is going to be happening on a contaminated site, and the environmental engineer will make certain comments based on that. She's also looking at drainage concerns. So one of the things that the Board of Health does is drainage, and we have
Like if somebody wants to build on wetlands or something?
or if you're building a so right now we just enacted new regulations, stormwater regulations, that basically say you cannot build anything which may cause a problem on someone else's property. So if you build a house, a driveway, a pool, whatever, you need to account for any runoff that's coming from your property, so that it doesn't go onto someone else's property and flood them. So That's one of the things that the environmental engineer does. She also does emergency response. So if there's an oil spill or something of that effect, the fire department will call us and we'll respond to that, and we'll kind of like be a liaison with DEP to see whether or not a cleanup has to occur. Yep.
Pull out the hazmat suits or not.
Yeah, we don't do hazmat cleanup, but we will
Tell them
try to get it.
you know.
Yeah, you need to get a company out here or whatever. So,
Okay.
yep. So she also does, we have a hazardous material building component policy, which requires that if you're going to demolition, or if you're going to do a pre-demolition or pre-renovation of a commercial property, you need to account for hazardous materials.
Like asbestos or something.
Asbestos. So in the pre-renovation, so if you're going to renovate an office building, you need to get it tested for asbestos and see if there's any asbestos present, and you need to make sure all hazardous materials are out and properly disposed of. Those come to us through the building department. For residents, it would only affect a resident if they were going to demolish their entire house. So.
Which seems to be happening a lot around Burlington now, but that's topic for another story.
Yeah, so all the contractors who come in and demolish a house need to come to the Board of Health first and get this, and fill out this pre-demolition checklist to make sure that they're accounting for all hazardous materials and that they've been removed prior to demolition.
Removed correctly.
Right.
Okay. So what are some of the hazards that might be in the house, like lead paint, carbon monoxide, radon?
So the Board of Health does handle household hazards, but it would be under the housing code or the minimum standards for human habitation, which is a state regulation that is enforced by the Board of Health. So if someone so under that regulation, you have to have a carbon monoxide detector in your home. You cannot have a child living in a home that was built prior to 1978 that has lead in it. The child has, if the child is under 6 years old. How do you get rid of lead paint? So it can be encapsulated or removed. So
I'm trying to think of how you would remove paint from a wall.
I think most of the time it's probably easier if they encapsulate it.
Yeah. And what is encapsulating?
So that it doesn't chip, because it only becomes dangerous if the paint is peeling off, and a child ingests it. So it has to be ingested, and it has to be peeling paint. So we get a lot of calls from mainly tenants who have various issues in their homes and need some help in getting their landlords to fix the problem, or even to draw attention to the problem. So we go out and we do a housing inspection, and they're complaint-based inspections. So we will only do them if someone calls us, and then we write an order letter to have it fixed.
Just tangent. Tenants versus landlord health issues. Long time ago, before I moved to Burlington, this is not in Burlington, I lived in an apartment with a crazy landlady, and it was 60 degrees or maximum in my apartment. And I told her that it was cold. Could I have called the Board of Health for heat issues?
Yes, yeah. So for certain
it wasn't
times of
lead
year,
paint, but it was, October, and it was 60 degrees in my apartment. And I'm thinking, come wintertime, it's going to be a lot colder.
Right. So yes, that's something that you could have called the Board of Health for.
What are the minimum heat requirements? Do you know offhand?
It's
62 at night and 68?
It depends too on what time of year it is. So it's I think it's from September to I forget the actual dates, but there are dates in the housing code that say between this time and this time it has to be this temperature. So what we would do is we'd go out, we'd have to do an inspection, we'd have to verify that the temperature was not correct, and then you would write an order letter to the landlord saying that they need to fix it. So did the landlord have control of your thermostat somehow?
Yeah, she did. and I had an electric heater plugged in, and she yelled at me because I was using too much electricity. And I'm like, well, it's, 60 degrees in my apartment and I'm really cold.
Yeah.
So it was also a not quite legal apartment for other reasons as well. So
Yeah,
I
it sounds.
kind of bailed after 2 months.
Yeah, and also under the housing code, you cannot compensate with an electric heater because those can be,
A fire
dangerous.
hazard.
Yeah, yeah.
It's like, but I was cold. And, electric blankets were just kind of scaring
Yeah.
me. I didn't want to use one of those. So, okay, you mentioned the environmental engineer enforcing certain things, or the Board of Health enforcing. Just thought of it now. What happens if somebody does not comply? Is it like, 3 written warnings and then fines, or?
It would depend on the regulation, so
Okay.
each regulation is different. So under some of them, we use non-criminal disposition, so that would be a fine. Some of $50 per day for the violation.
Okay.
Some of them have higher fines. Another thing the environmental engineer does is there's a local bylaw that's enforced by the Board of Health called the Control of Toxic and Hazardous Materials. So any company who stores hazardous materials or chemicals over 220 pounds is required to register with the Board of Health.
Okay, something like a pool supply store with all of the chlorine.
It would have to be, well, that's one of the things. So if it's in the line of commerce, it's not required unless it's over a certain amount. So if they had a 50 gallons of, they were selling 50-gallon containers of a pool chemical, then yeah, they would have to register. But if they were selling, oil in small containers, then they, in the line, they wouldn't have to. So,
but thinking, the inventory would probably total more. Okay.
Right. So mainly we have gasoline stations, auto repair shops, laboratories.
Thinking Leahy must be a big one for biohazards and.
Leahy in the laboratory, they have certain things in their lab. So yeah. So that's one thing that she enforces, and that bylaw has fines up to $200. So because it's a bylaw and it's written that way, the fines are a little bit different. So we would fine if we had to. We could take them to court. So if we needed to, yeah.
So back to Hazardous Waste Day. There's only 2 of them. What happens in between? Can a resident call the Board of Health and say, hey, look, I don't want to wait until April?
So we'll take mercury-containing products at our office. So if you have light bulbs, thermostats, thermometers, we'll take them at the office. We'll also take small batteries at the office. We encourage people they can also pay if they want to go. There's a facility in Lexington that you can go, and if you don't want to wait until the next collection, you can pay to get it disposed of. We encourage people to kind of hold the things aside if they can, though, because it's economically better that way, because the town pays by the carload. So if you come and you have a carload, it's going to be, if you have a full carload or you just have a little bit, it's going to be the same amount as if it's better off to go with the full carload. We encourage people to
talk to all their neighbors.
To the neighbors, and have one person bring everything down, because
so that's good
it's
to know. I did not
cheaper
know
for
that.
the town to do it.
So there's somebody like with a little clicker going car 1, car 2, car 3.
Yes, they count. Well, it's the vendor. So we have an environmental vendor. I'm sure you've probably seen the pictures in the paper with the guys that have the suits on and the drums. So the vendor is the one that counts, I'm going to count this as a full car or half car. So if we have one person that comes through with 1 little gallon of paint, we're paying the same amount if we have,
6
half
things
a car
of paint.
full. Yeah.
Yeah. Or a dozen.
So, and then we also pass out at our event ways for people to, information on ways for people to recycle. We want to encourage people to use less if they can. So only buy what you need. If you only need, a can of paint, or buy 1 can of paint at a time, or But by the way, latex paint is not a hazardous waste, so latex
Oh.
paint can be dried out and put
Okay.
in the trash. It's the oil-based paint and the solvents
I did not know
that are the
that.
hazardous waste. So we
Okay.
tell people, please don't bring the latex paint to the
Because
hazardous
we're paying
waste.
for hazardous waste and it's not.
Right, right.
Okay, very good to know.
So there are places, and one of the things we don't take is we don't take electronics.
Okay, yeah, because I was wondering, like computer, like computer monitors. I learned recently are hazardous waste.
So you can call the town,
Okay.
at the DPW
Yeah,
on their
DPW
website.
will
I think it's Appliance Recyclers is the name of
Okay.
the company, and they'll come and pick it up. And
Okay.
you give them a date. They'll give you a date, and they'll come and pick it up for free. I think you
Okay.
get 2 a year or something like that.
Oh, okay.
Best Buy will also take things back.
And I think
like
Staples might, and I know
phones and-
some companies do. Like
Yes.
my husband's company, a couple times a year, they'll do, electronics collections. So,
We also do cell phone recycling in our office.
Oh.
So people bring in phones, and
Okay.
we send them away for recycling, and the proceeds for that go to the food pantry.
excellent. That's good to know. So these are like non-working cell phones, because working cell phones, you can a lot of times drop them off at the police department. They can go to like battered women's shelters.
Oh,
and
okay. Yeah.
used for like
Did the
emergency.
police do that? I don't know.
Think.
Okay.
I think. Well, I probably shouldn't say that. Oh, okay. Moving right along, because we are doing pretty well on time. What is the role of the health agent?
So the health agent is responsible for inspecting and permitting a number of establishments. So food service establishments, tanning facilities, recreational camps for children, mobile food vendors,
Okay.
like trucks, mobile food
Okay.
trucks.
The Roach Coach.
Temporary
shouldn't say
food
that.
events.
Temporary food events would be something like Celebrate Burlington, where there's like the.
Celebrate
okay.
Burlington, Taste of Burlington. That's another temporary
okay.
food event. I'm missing any. Tobacco retailers. So we
okay.
recently changed our tobacco regulations where we didn't change them. We added. So we have sale of tobacco and sale of non-tobacco nicotine delivery products, which is
Oh, like-
e-cigarettes.
Oh.
So
okay.
e-cigarettes
Does
are
like the gum count? Is that too?
no,
Okay.
they have to be vaped. So any of those,
Okay.
if you can vape it, then it would be considered.
Okay.
That was one of the changes that we had probably around, I think that came in 2011 or so. We also did smoking in the workplace regulations.
Okay. Is that like
which is enforced by the health
some of
agent.
them like the 20 feet from the door as well?
Well, no, there is no real. That's a common misconception. I think that
Okay.
people have. Oh, you have to be so much feet away from the door, but
Okay.
really, what it is it can't come back into the building. So whether you're 20 feet from the door or 50 feet from the door
Okay.
or 2 feet from the door, if it's not coming back into the building,
Okay.
is what the issue is. So if you're far away from the building and it's coming somehow it's coming back in there, then it would be a
Okay.
violation. So in that as well is e-cigarettes. So you cannot
Okay.
smoke an e-cigarette in Burlington in a place where you couldn't smoke a cigarette. So the same rules apply for e-cigarettes
As well as like
cigarettes.
cigars and pipes and all of that other kind of tobacco products.
yeah.
Okay.
Yeah.
Oh,
So
right.
she also does reviews for new foods, plan reviews for any new restaurants. So any new
Okay.
restaurants coming in.
So does
will
she
review-
work with the environmental engineer on plan developments, or?
Yeah. So if things come in from the planning department,
Okay.
she will also comment on those if she needs to. But regardless of that, if they need to fill out a plan review with us anyways, a restaurant.
Okay.
So they usually come to us first, any new
Okay.
restaurants. So she's on top of that. She also does.
She must be really busy lately with all of the Third Avenue expansion. There's
Yes,
a bunch of
we've had-
restaurants going up Middlesex Turnpike, and
Yeah, there's a. I think
does she get to
there's
sample any of the food?
One of them is opening an Italian one.
Oh.
Pretty soon. We're not
Okay.
open yet over there, but I think that's the next one to open.
Cool.
Yeah.
I haven't been over there. It's too intimidating.
So no, she doesn't sample the food. Will not sample the food. No.
Just checking, just checking. I think we may have touched upon this, but how does the Board of Health respond to like resident phone calls? Is that part of the health agent's jurisdiction? Or?
Yeah, so that's all of us. So we take in all calls from residents, we take them in, we keep the information.
Like if somebody suspects food poisoning from a particular restaurant?
Yep,
or?
she will investigate foodborne illness, so that's another thing that she does, any foodborne illness investigations. So if somebody calls and says, I noticed this at this restaurant, we'll take in all this information, we fill out an investigation report, and give it to the appropriate person. All the information is held confidential, so we'll get people that call in and say, well, I don't want to give you my name because I want to be anonymous. But the reality is that we'd like people to give us their name and phone number, so if we have any questions, we can call them back.
Okay.
And we keep all that information confidential, so we won't give out your name and we won't tell.
You're not going to go to the restaurant and say, Joe Smith said.
Right.
Okay.
But we also do trash. We do nuisances, we do drainage.
What kind of nuisance?
A nuisance might be like an odor.
Okay.
Odor complaint.
Would it be like noise as well? Okay.
Noise is another one, yeah. We would do environmental, so if there was a spill or someone noticed something sitting on the side of the road or something like that, we would do that. We have animals, so beavers is another one that we do. Yeah. So
I've never seen a beaver in Burlington.
we have them.
I'll have to check it out.
Yeah. Mainly, there's a lot over in the Vine Brook area.
Okay.
And yeah.
Okay.
Yeah.
I'm just curious. I like
Muller
critters.
Road along there.
Okay. Yeah. We have a lot of critters going through our yard, but I haven't seen a beaver yet.
Yeah. Well, the problem with the beavers is that they'll build their dams and then they'll flood roadways. So
minor technicality.
Yeah. So.
Okay. Now, speaking of restaurants, what about like food allergies? What are food allergy awareness regulations? I didn't even know there were regulations for.
Well, they were enacted in 2010.
Okay.
And
is this like through schools or restaurants or both, or?
So any establishment that serves, cooks, or prepares food for immediate consumption,
okay,
then needs to adhere to the food allergy awareness regulations, and that means they need to have a poster in the employee area.
Okay.
They need to train their employees on allergy awareness.
Okay.
And they need to they need to post on their menus and their menu boards a notice to consumers.
Okay.
So ultimately, though, it's the responsibility of the consumer to let the server know that they have a food allergy, so that the server can then alert their manager, or they themselves can alert the kitchen staff that someone has a food allergy.
Okay. Well, sometimes food allergies or the foods can't be separated. If there are peanuts in the kitchen, everything could potentially be contaminated, right?
Well, that's what the training is for. So the kitchen staff and the servers, there's a certified food protection manager on site that would need to be trained in. And so when we give out a permit, we make sure that we see that certain people have been trained in allergen awareness.
Now,
so that's part of our permitting process.
Does the Board of Health provide the training as well?
No, there's a separate companies that will do the training.
Okay.
So we can usually we could. I don't know if we have a list or not, but they usually can know who can do the training. So we don't provide the training.
Okay.
So it's a private company that will provide training to them.
It's like, okay, you require training, but
Yeah.
So a little while earlier you mentioned camps, and why is it that we can't call a camp anymore? Or some places, like I think Simons Park, the summer camp program is no longer Camp Simons, it's Club Simons.
Right. So we enforce, those are state mandated regulations enforced by the Board of Health. minimum standards for recreational camps.
Okay.
And in those regulations, there's a definition of what it means to be a recreational camp.
Okay.
So these summer programs don't meet that definition.
Okay.
However, in the regulations, it says if you advertise or promote yourself as a camp, then you need to adhere to the regulations.
Okay.
So they have chosen not to advertise or promote themselves as a camp.
Because they don't want to conform to all the regulations.
Yeah, and that's important. It's important that people know this because it could be misleading. So if you're advertising yourself as a camp,
Okay.
then people might think that you're being inspected and permitted by the Board of Health, when in fact you're not.
You're not.
So when we see, anyone that's advertising themselves as a camp, we need to tell them, you either need to adhere to the regulations. If sometimes they might meet the definition,
Okay.
sometimes they might not. So,
Okay.
but if they advertising as a camp, whether or not they meet the definition,
Okay.
they need to adhere to the regulations or change their name.
Okay.
So I think that's what is happening there.
Okay.
So parents can always call us, and
Okay.
if they have any questions, if they want to know, I want to send my child here, is this inspected by the Board of Health, we can let them
Okay.
know. And we
Okay.
want we want that to them to bring it to our attention too. If something is being advertised as a camp,
Yeah.
we want to make sure that either they're not advertising as
yeah.
a camp or they're being inspected.
Well, in general, it's easier if people come to the board, contact the Board of Health, because, as we mentioned earlier, there's 5.5 people on your staff,
Yes.
and there's a lot of ground to cover in Burlington. So, there's always something going on, and there's no way physically possible for you to know everything, all the goings on.
Right.
So, need
Yep.
the community.
Yep. And we do. Our health agent.
It takes a village.
but our health agent does a good job of keeping her eye out on.
Oh, I'm sure she does. She,
Um,
right?
yep.
She. Okay, I'm sure she does, but,
Yeah.
it would be nice to help her out once in a while.
Yep.
So, what's the role of the public health nurse?
So one of the main things that the public health nurse does is monitor communicable disease. So there are Massachusetts regulations on the reporting of communicable diseases.
Okay.
And there are 80 communicable diseases, or around 80, that are considered dangerous to public health. So laboratories and doctors are required to report to the local Board of Health in which the patient is residing if they have been
One of these.
confirmed case of a communicable disease.
Okay.
So the
Like pneumonia or something, or the flu, or
influenza is one of them, is a
get
communicable
vaccinated.
disease. Yes. So there's a web-based surveillance program called the Massachusetts Virtual Epidemiological Network, or MAVEN. And that's what the
I'm glad they have an
public-
acronym for that.
that's what the public health nurse uses
Okay.
to do case investigations on communicable disease and how we get the reports in.
Okay.
So that's something that needs to be monitored constantly to make sure, so that the nurse is aware of any communicable disease in the community. If there is a case of a communicable disease, depending on what it is, there's follow-up involved. So she might she'll have to call the person, find out who you were in contact
Okay.
and what time, when
Were you
were
on
in
a plane
contact.
from West Africa
Right.
during this time
Yeah, and then she would have to get in touch with all the case contacts and then inform them and get information from them as well. So depending on how, what the disease was and how many contacts there is.
Okay.
And TB falls under that as well. So she also does that for TB cases.
Okay. There's still a test for TB. I remember, like, in elementary school, they did that little prick thing
Yep.
that looked like a little mosquito bite.
Yep, and we do TB testing. The nurse will do TB testing if she has case contacts. So for instance, if we had a TB case and they came into contact with 10 people, then we would do the TB testing for those people. They could come into our office and then come back
okay.
2 days later. So you get kind of put under the skin, you come back 2 days later and then it's red, or see if it's any bumps there that came
okay.
from the test. That's how the test is read. We also do TB testing for residents, so sometimes a resident might get a new job or be entering school that they need a TB test. So we provide that service free
Oh.
for residents.
Okay. I didn't know that either. Cool. Mentioning the flu vaccine, I'm just thinking this is a whole other show entirely, but the pros and cons of getting vaccinated, because I know that after was it smallpox out? Measles out in California?
In California, the Disneyland.
Yeah, the Disneyland thing, and then there was this flurry on social media about, to vaccinate or not to vaccinate. So just kind of made me think of that. But I won't put you on the spot going. What's your opinion on that? Okay, we've talked about the flu clinics. How successful are they? Did we talk about?
They've been.
They seem to be like. Okay. Yeah.
Yeah, I mean, I think that they're very successful, and we plan on doing another one next year. We're probably going to do another large-scale exercise again because it's.
Now, what are the small-scale exercises? Are they also smaller flu clinics?
Yeah,
or?
so we might have one at the Human Services Center.
Or the Senior Center.
Yeah, which doesn't require all those volunteers because we don't have as many people coming in. Sometimes they're done later in the season. We might have one for town employees or may just have one for seniors so it depends on how much vaccine we have left too after the large-scale clinic. So the Board of Health, the board themselves decides on whether or not to purchase vaccine, and they have made that decision to purchase for next year. So it looks like we're going to have most likely another large-scale event next year.
Okay. Excellent. So I heard recently that the Board of Health is sponsoring an upcoming health fair.
Yes.
Can you tell me a little more about that?
Yeah, so that's going to be Saturday, May 2nd from 10 to 1 at Memorial Elementary School.
Okay.
So the Board of Health is collaborating with the Council on Aging, and it's sponsored by Leahy Health. And we are finalizing now the exhibitors that are going to be there.
Okay.
So we have bone density screening, oral cancer screening, I think sun facial damage screenings, BMIs, blood pressure screenings. Those are some screenings we have. We have educational tables. We're going to have on nutrition, gardening. We have on food safety. And we're also going to have fitness demonstrations. So we're going to have, this will be in the gym area. So we have an obstacle course for the kids. We're going to have someone doing boxing demonstrations.
Ooh.
Someone from the Burlington Recreation Department doing exercise demonstrations. And
I heard Zumba is like the big thing right now. I've never done it. I'm afraid to do it, but
yeah, I think the Recreation Department has a Zumba class.
They do.
So we have over 35 exhibitors.
Excellent. So even though it's like sponsored, I think you said one of the sponsors was Council on Aging, it's not just for the senior population.
Right, it's
like for everybody.
The whole town. So the Council on Aging used to have one in the fall at the Human Services Center.
Okay.
So the idea we had was kind of to combine that, but also to have a larger one for the whole community. So we work with the Council on Aging on getting some vendors there or exhibitors that would be geared towards seniors, but we also have brought in a lot of other exhibitors as well.
Excellent.
And there's going to be free rides for seniors, so if anyone wants a ride.
Like free rides, like roller coaster? Sorry.
Any senior
Mindset.
who would like a ride to the health fair, if they
Okay.
call the Wednesday before, the senior center, I think it's 270-1950. If they call them, they can provide them for a ride to the event. So,
Okay.
yeah.
Excellent. Like a little shuttle bus or something?
Yeah, they have a van that will pick up
Excellent.
seniors, so that's going to be available to them that day.
You got to call, make an appointment.
Yep.
Okay. All that information is on your website, on the Board of Health website?
Yes.
Okay.
Yes. So they can call the Board of Health if they have any questions. But yeah, if you go to our website, burlington.org, and click on health, I think it's up on if it's not up, it will be up shortly on the latest news page.
Excellent.
Yeah.
Good to know.
So we have a number of exhibitors from town, the Burlington, of course we're going to have a table. The Volunteer Reserve Corps will be there, the Police Department, the Fire Department, the Council on Aging, the Recreation Department, the Burlington Chamber of Commerce, and Leahy Health. We have a lot of different and varied demonstrators. Burlington Public Schools is going to be there with the Science Center and the obstacle course. And,
Fun. So that's May 2nd, Memorial School, 10 a.m. to 1 p.m.
Yep.
Write it in your calendars. Put it in your smartphones. Speaking of smartphones, does the Board of Health have anything to do with the whole texting and driving initiative? Because it's a health hazard, it's a public health.
Yeah, that's not
Potential.
something that we've been involved in.
Okay.
They are going to be at the health fair,
Because
though.
I just remember, like, I think one of the Celebrate Burlington's Leahy Clinic was there, and they were talking about the texting and driving thing.
They're going to be at that's one of the things that they're going to do as the text. So far as I know, Leahy's going to be doing that, the bone density scanning, and maybe a healthy cooking demonstration. We're hoping.
Now, I did mention in the beginning of the show, because we are getting close to being out of time. I can't quite see my timer yet. 3 minutes. I know I couldn't be subtle that time. But anyway, yesterday, April 7th, is World Health Day. I have no idea what that means, but it made me call you. So do you know what World Health Day is?
So it's sponsored by the World Health Organization, and it's a day set aside for global health awareness to bring attention to a health topic. And every year it's a different one. So this year it's food safety. So
Food safety, okay.
Yes. So they're trying to draw attention to food safety initiatives, which is important for everybody across the globe, to make sure that you make sure your food is thoroughly cooked. It's coming from safe sources, that you're using proper hot and cold holding temperatures for food, that cleanliness, washing your hands, washing the surfaces, and also keeping raw and cooked foods separately to prevent cross-contamination. So those are the kind of like the five, they call it the 5 keys that the World Health is calling it, to food safety. So they're trying to draw attention to that, which is...
Now, did Burlington do anything special for World Health Day, or?
We are having a food safety table at the health fair. So the health agent will be there, and she's going to be giving out food safety information to residents, and will be available to answer any questions that people may have.
Okay, so when you order that rare hamburger, it should not still be mooing.
Right, it should be cooked to a certain temperature.
Okay, and there was one other question that I thought of, and it completely escaped me now. Food safety and food preparedness safety, was that it? Food safety? Does clean water come into any of that?
Yeah, so the World Health Organizations, when they say use safe materials, is saying use safe water and safe food. So yes, make sure that you, and it may not be an issue for us in Burlington as it would be for someone, across the globe, but that is one of the things that they're focusing on.
Okay. Again, food safety, stream of consciousness. Sometimes I've gone into places and they've had like a sink that says, hand washing only. It's water, it's soap. Why does hand washing have to be separate from, why does it need its own sink?
So that's part of the regulations. That's part of one of the things that we enforce. So the health agent enforces that. There needs to be a designated sink just for hand washing under the regulations. So that's why, because you don't want to be having cooked chicken in a sink that that you're going to be washing your hands with. So,
but you know what? We are out of time. See, and it flew by, and I still had questions left. But hopefully, we answered enough, and I do appreciate your coming on.
Thank you.
I look forward to May 2nd to celebrate April 7th. Home this evening for tuning in to Something to Talk About. Hopefully you enjoyed our topic on health, and good health to you. Have a great evening. Good night.